Hi, I'm Anita Zacharias, and in this video segment we will try and identify the different parts of the pelvic diaphragm and also try and look at the attachments of these different parts of the pelvic diaphragm. Before we look at the pelvic diaphragm, let us try and identify two of the muscles that you have already looked at that lie in the lateral wall of the pelvis. Covering the obturator foramen would be the obturator internus, and taking its origin from the anterior surface of the sacrum and passing through the greater sciatic foramen, closing it, would be the piriformis. Let us now identify the pelvic diaphragm. The pelvic diaphragm is made up of an anterior muscle, which is called as the levator ani, and a posterior muscle, which is referred to as the coccygeus. You would differentiate the fibers of the pelvic diaphragm from the other muscles in the lateral pelvic wall because of the direction of the fibers and looking at its point of origin. If you look at the fiber direction of the fibers of the pelvic diaphragm, the muscle fibers will run inferiorly and medially, and they will meet the muscle of the opposite side. Looking at its origin, the origin of the fibers of the pelvic diaphragm will be continuous. They will commence from the posterior surface of the pubic bone, will follow a continuous line, taking its origin from the fascia over the obturator internus, and it will end posteriorly at the ischial spine. Let us now look at the individual components of the pelvic diaphragm. The posterior most part of the pelvic diaphragm is the coccygeus muscle. The coccygeus muscle would be identified because it lies superficial to the sacrospinous ligament, and therefore they will be attached to the apex of the ischial spine, and if you trace the fibers down and medially, it will get attached to the coccyx as well as the lateral margins of the sacrum. Next, let us look at the parts of the levator ani. The levator ani will be made up of three subparts. The most posterior part of the levator ani is the iliococcygeus, and as you can see, these fibers will have their origin from the fascia covering the obturator internus. Fibers run downwards and medially, and they will meet the muscle of the opposite side. They will also contribute largely to a midline structure that lies just posterior to the anus, and that midline ligamentous structure is called anal-coccygeal ligament or raphe. We will identify this raphe or ligament in subsequent images. The second part of the levator ani is referred to as the pubococcygeus, and as the name indicates, it will take its origin from the posterior surface of the pubis. Fibers run downwards and medially, would lie along the midline, and will get inserted posteriorly into the tip of the coccyx. Since the pubococcygeus is the medial fibers or the more anterior fibers of the levator ani, it will be closely associated with parts of the anus in both male and female, and parts of the terminal parts of the reproductive system. So you have subdivisions of the pubococcygeus, details which are not necessarily to be identified in second year anatomy. The most medial fibers of the levator ani is the puborectalis. It's the medial most fibers of the pubococcygeus runs in close association with the pubococcygeus. But these fibers can be differentiated from the pubococcygeus because it will form a sling around the rectum or around the terminal part of the rectum. So this sling-like arrangement will help you identify the puborectalis. This sling helps to maintain the angle between the terminal parts of the rectum and the anal canal. If we look at an inferior view of the pelvis, you will try and identify the same segments of the levator ani and coccygeus. So seen most posteriorly is the posterior most part of the pelvic diaphragm, which is the coccygeus. Some textbooks would also refer to it as ischio-coccygeus because of its origin from the ischial spine, and its insertion into the lateral aspects of the coccyx as well as the sacrum. Next, you will identify the iliococcygeus, and seen along the inferior view very clearly is the anococcygeal raphe or ligament that we spoke about earlier. Lying more anteriorly would be the pubococcygeus, and you will see how these fibers are closely associated with parts of the reproductive or the urinary system and parts of the gastrointestinal system. Seen between the urogenital hiatus and the anal aperture is a fibrous structure which is of great importance. This fibrous structure is seen both in males and females and is referred to as the perineal body. The perineal body is of more importance in females, and it is the point of insertion of most muscles associated with the external genitalia. So the perineal body lies anterior to the anal canal and posterior to the vagina, as well as the bulb of the penis in males. Its importance would be that it's a point of insertion for the muscles of the perineum, the region of the perineum being the region of the external genitalia, and it will also receive some fibers of the pubococcygeus muscles, so muscle fibers of the pubococcygeus associated with the reproductive and urinary systems. Any disruption to the perineal body would mean that there is a lack of support to the pelvic outlet, and this could lead to the prolapse of the pelvic viscera. You would have already identified the two different parts of the pelvic diaphragm. The anterior part of the pelvic diaphragm is referred to as the levator ani, and the posterior part of the pelvic diaphragm is formed by the coccygeus. Let's try and identify the different parts of the levator ani in this model. The first part of the levator ani is the pubococcygeus. It can be identified in this model because of the fibers running from the posterior aspect of the pubis. Fibers run along the midline, run posteriorly to get inserted into the coccyx. The second part of the levator ani is puborectalis. Though not clearly identifiable in this model, it should be identified as being the medial-most fibers, and remember that these fibers form a rectal sling around the terminal part of the rectum. The third part of the levator ani, clearly identifiable in this model, is the iliococcygeus. The iliococcygeus runs from the lateral aspect of the pubis, taking its origin from the fascia over the obturator internus, and fibers run downwards and medially to meet the muscle of the opposite side. These fibers will get inserted into the anococcygeal ligament or the raphe. This anococcygeal ligament or the raphe will run from the posterior aspect of the anal aperture, running all the way back to the tip of the coccyx. The posterior part of the pelvic diaphragm is completed by the coccygeus. The coccygeus should be identified in this model as being the posterior-most fibers, and more importantly, it will overlie the sacrospinous ligament. So you can identify the ischial spine and the sacrum and the coccyx. So that's where the ligament would lie. So the coccygeus will overlie the sacrospinous ligament.